Same thing as the lungs. The lungs have the same kind of function. Just going to draw what we call an alveoli, and the outside triangle represents the lungs. When I open up the lungs, I move air into the lungs. When I close them off, I move air out. As simple as that. So let's take a look at how we do that. One of the main muscles in inspiration is called the diaphragm. It opens downward to allow the movement of air and oxygen into the lungs. What happens if I want to remove air and oxygen from the lungs? Well, the diaphragm relaxes and the chest wall caves in, and there's some muscles that are associated. The muscles that are associated with inspiration and expiration, I just grab my hands and put them in a pocket. So these elevate and open up the lungs to move air in. These guys depress and close off the lungs or close off the chest wall to move air out. These ones are called external intercostals, and these guys are internal intercostals. So what is the primary muscle involved in inspiration? It's called the diaphragm. What are the other muscles that are also involved in inspiration and expiration? Well, inspiration would be elevating the lungs, so we call external intercostals. What is inter? In between. What is costal? Cartilage of the rib cage, so intercostals. And the other one that moves air, so this is for inspiration, and this one is for air expiration, and it's called the internal intercostals. There are more muscles than this, but for now, we're going to just review these three. So take a look again. In order to move air in, I contract the diaphragm downward. In order to increase the volume, I also can expand the chest. And what expands the chest? We elevate with the external intercostals and we depress the diaphragm. Again, we want to get rid of the air from the lungs. Then we relax the diaphragm and we also compress the chest with the internal intercostals. Great, we'll take a break.